Hello, my name is Amanda Simonton. I am a graduate student at UT in the nursing school. I graduated from UT with my Bachelor of Science in Nursing in May of 2013, and then I went and worked in the intermediate care unit at Seton. I quickly went back to school for my BSN to PhD, and then within that program I decided to go back for my psych mental health nurse practitioner degree. I've also worked as a psychiatric emergency room nurse, and I've been a research assistant and TA while in school at UT.
So what prompted you to go to nursing school in the first place?
Well, let's see. I initially started off as a biochemistry major when I went to UT, and I was super gung-ho because I was going to cure cancer. But I quickly realized that by being in a hard science that I was going to be restricted to a very lonely career in a lab. And I had a best friend that was a nurse, so she kind of told me a little bit about it, combining science with psychology and sociology, as well as caring for people, so I was very interested in that aspect of it. Additionally, since I was going to have to pitch the major change to my dad, who was supporting me through school at that time, I wanted to make sure that my prospects looked good if I was going to go and switch careers paths. So I looked at the job market as well, and I mean, it was wonderful. All I heard was you could do a lot with nursing and you're always going to have a job.
So did that work out? What was the job market like whenever you graduated?
So it was competitive, but only because that was my first job. That's just how it is. Your first job out of undergrad, it's usually kind of competitive to find exactly where you want to be. But all the jobs are there. And since I was a nurse, like after I got that foundation in my residency in, I mean, I can really go just about anywhere at almost any time and become a nurse. Like I have no worry of ever needing a job because nursing job, I mean, there's a huge nursing shortage, so.
Yep, and that kind of perfectly tees up what my data visualization project is pointing to, that there will be a shortage of nurses in the next 10 years. So, now that you're in graduate school for nursing, so you're still affiliated with the nursing school, do you see anything different from when you first went? Do you see anything being done to kind of proactively address that potential shortage?
So it's funny that you mentioned that your data says in the next 10 years there'll be a shortage. Like we're already at that point. We already have issues with staffing at times, and then certain hospitals try to cut down to where we're changing patient ratios to where, instead of having one nurse to 3 patients, you're having one nurse to 4, and that can be detrimental to outcomes depending on what kind of unit you're on. So it's funny that that's long term, but I mean, it's happening now. So to hear that that's going to also happen in 10 years when the baby boomer generation finally hits, it's just, I can only imagine it being somewhat of a crisis. However, now that I've been back at UT and, more on the teaching side, the issue is really like what comes first, the chicken or the egg. To get more students, you need faculty that can support them, because it's not like another degree where we can say, okay, let's start to include 10 students extra each year so that we have more nurses. The issue is with that is that we have to do clinicals, and you can only have 10 students to 1 professor. So you need more professors to be able to facilitate student growth, more nurses. But we need more people going back to be professors. Since we already have a limited number of nurses that already don't necessarily want to go back to do that, it's really hard to find how we're going to meet that need. As well as I don't necessarily think that our profession makes it clear to high schoolers per se of what type of options are available to them if they pick this as a degree program. So I don't see a lot that's necessarily happening like to proactively try to change this. However, I have seen things in the community, such as recently ACC became, they'll now be offering a bachelor's of science to nurses, where before it used to just be an associate's degree. So that's appealing to a lot of people, and they might be able to get more students to come into their program. And if we could see that happen in other community college that make it accessible for people to actually go back to school, then that might be able to meet a little bit of the need, but we'll see.
Well, and as someone who might want to, go into academia postgraduate degree, is there anything that you can think of, like what ACC is doing, that might help address this potential issue, even if you're not seeing it done yet?
So, I mean, that was just it. Like, that is what ACC's, they're making it more accessible to get a degree that people need. So, more hospitals only want to hire BSN nurses. ACC made their program a BSN program. They also get a lot of applicants that go through there, so now they're going to get even more. But it's like, again, it's hard to find. We're between a rock and a hard place. Like, we can't really facilitate much more growth until we can also encourage the graduates that we have to potentially come back to teach. So I think that would be where a program could start, is really trying to make teaching seem tangible to bachelor students, to come back and get a master's and then become a teacher. But we'll see what happens.
Sounds great. Well, anything else you'd like to add? Maybe a shout out to any people who might want to become a nurse?
Yeah, I mean, I was going to say, I was like, if anyone ever just happened to see this video, just be like, I know that you've heard me say this before to other people, that like anyone who's ever like, I don't know what I should do, it's like, go into nursing. Like, it's an incredibly hard degree because of the science that's involved and the critical thinking, but once you get there, you have so many options. Like, I could go and teach, be a bedside nurse in a whole bunch of different fields. I could be a school nurse. I can do sales if I want to. It's unlimited. So I think that's my shout out.
Thank you very much for your time.
No problem.